if from what you said, from what I could understand from that, I'm not a medical person, but if you're saying some of the symptoms could be something that comes in like 5 minutes or shorter than that or longer, what are the recognizable symptoms of a stroke?
Right. So some of the most obvious signs of a stroke would be drooping of the face. Usually you notice the side of your mouth go down, one side of the face will droop down, and you have the eyes, the face, and the side of the nose drooping down. And if you try to smile, you realize one side of the face goes up and the other side of the face just stays down there. This is one very obvious sign for most people. And a second obvious sign would be slurred speech. So you try to speak, and it's like, I want to say this kind of speech. When you hear someone speaking like this, it's not coming out clear or it's sounding very confused. This is a second sign of a stroke. But it goes beyond that. You can find that they actually cannot even move an arm. So you ask them to lift up their arms, one of the arms goes up, the other just doesn't, or one of them is higher than the other one. You might try to move your fingers in front of their eyes and you find that they don't follow, or one eye seems to follow while the other doesn't. And this kind of person may be confused when you ask them questions. You ask 2 or 3 questions, they can't answer you correctly. So I won't expand this too much, but basically these are the clear signs that you can see.
Thank you very much, sir. Dr. Gojay, please. I would, from what he explained, I noticed that even though it's very clear to me what the symptoms are, can you tell us why some victims can't really identify they're having stroke? For example, maybe cultural reasons, or maybe there's an internal struggle that makes it not obvious to the person having it, or the other people outside can see. So what are the things that makes victims not be able to recognize stroke?
I'm going to go straight by trying to explain what makes victims not recognize stroke so early. Firstly, because sometimes strokes are being, how can I say, are being confused to other things, to other diseases. The first thing a patient is supposed to know, I'm going to add something on what Dr. Balinga said, is the headache. When we talk about headache, it's a very important indication of stroke. It's a kind of headache you've never experienced before. So sometimes when people got headache or dizziness or maybe blurred vision, they will not take it serious. But specifically, this kind of headache is very severe. And then once you have that kind of headache, you should know it's an indication you are having a stroke. But mostly, it's very easy for people to recognize strokes, like he explained in the symptoms of strokes before I spoke. So I'm going to add something in what he said that is going to help our audience, our audience. Like we say, act fast. The FAST acronym is really important to recognize someone is having stroke, because someone himself might not know, but the person near him should be able to recognize the symptom. So by the acronym FAST with F, you check the face of the person. Does the person have a face drop? Ask the person to smile. Is a smile uniform, like both sides of the face? If one side is dropping, then that is an indication. We go to A, after F is A, the arm. You can ask the person to put the hands, the arms up, and you check if it is uniform or one hand is lower, or if the person have difficulties. And then you go to S, the speech. Sometimes people that are experiencing stroke have slurs, like their speech is not really clear. And then you can ask them to repeat a sentence. And if the words are kind of slurred, you know, the person is experiencing stroke. And the T is about time. When we talk about stroke, time is very important, because sometimes we can minimize the symptoms, but we should understand like the management of stroke is mostly important because of time. If you are not managed in time, then the how can I say, the effects can be irreversible. So that's what I have to say about that.
Thank you very much. Now, I understand it, and I believe our viewers also understand the symptoms of somebody having a stroke. I just want to know, is it gender, race, age, or body type indifferent? Because I know there are some, I've heard about some diseases that the way they show up in a person of color's system is different from another person from another race. So is stroke indifferent to body, age, what gender, or anything like that, Dr. Tony Balinga?
Thank you very much for coming back to me and directly, and the answer is yes. Strokes, you know, they occur more often in people who are 55 years old or older than that, but they're above 60. So if you're above 55 or 60, you have to be a little bit more careful about your health. And with regard to race, yes, it is known that Black people, for one reason or another, tend to have a higher propensity than people of other races. Also, when it comes to gender, it is known that men have a higher risk of having a stroke than women. But women do get strokes too. However, the majority of women who do get strokes will get them at a much later age than men. And most of the time, if it happens, it will be of the hemorrhagic type. So you have the bleeding in the brain, and their chances of dying of that stroke is higher. Meanwhile, a lot of men get an ischemic stroke, and most of them will not die of it, but will lose certain functions. So yes, it is gender specific, it is race specific, and it is age specific. It also is, you know, there's more risk with people who are overweight or extremely underweight. Both of these cases, extreme underweight and extreme overweight, are at risk of having a stroke.
Thank you very much, sir. I'm getting to understand some things from what you said that are very private to me, and I'm holding all the information you've given in my left hand, so I don't use my right hand to eat. Now, let's go to Dr. Goje. Dr. Anthony Balinga said something about women and the difference between this in women and men. Can you please explain further?
Yeah, before I'll explain further, I would like us to classify the risk of stroke, because what we are talking about now is the risks of the risk factors of stroke. Like, we can divide into two. There are some preventable risk and unpreventable risk. The age, gender, genetics, race, and geography, they are all unpreventable risk. From the studies and from what I've read, I think gender is also a risk factor, because the incidence of stroke in men is more than the incidence of stroke in women. And then talking about the modifiable risk factors, like Dr. Balinga said, he talked of high blood pressure. So I'm going to add some more things like smoking, like diabetes, like elevated cholesterol. Please, about smoking, if you are smoking, now we have like more management to help people to stop smoking. There are medicines you can get access, and they're very cheap. And if you're not smoking, you should stop smoking, because smoking causes plaques that are deposited in our blood arteries. And once there's an accumulation of plaques, the next thing will be the blockage of that artery, which is going to obviously cause a stroke in the long run. And there are also cardiac issue, narrowing of the carotid artery, and other peripheral artery diseases.
Yes, thank you. Thank you, Dr. Goje. That was somewhere I was going after that. I was thinking, what habits? Because you just mentioned smoking and some other. I want to ask, are there foods that could cause stroke? Because I don't smoke. I would give an excuse, oh, I don't smoke, maybe I can have stroke. But are there food, are there drinks, or some other excessive habits we do? Maybe exercise? I really don't know. Can you tell us more? Dr. Goje?
Thank you
Yeah.
very much.
Okay, Dr.
Yeah.
Anthony is going to tell us.
We have. Okay.
Yes, Dr. Anthony, you can speak to us, please. Thank you, sir. Can you hear us? We can't hear.
Is it for me?
Yes, Dr. Anthony Balinga, yes. It's for you, sir.
All right. So I'll take it from here. Yes, there's of a stroke. Am I still online?
Yes, you are.
Hello? If you can hear me, I'll go along. I'll just continue. There are spicy foods, highly salted foods, or very sweet foods. Kinds of foods.
I really cannot hear anything.
Yes.
You can ask.
Can you please check your internet?
These kinds of foods will put people particularly at eating of vegetables and fruits. Thank you.
We didn't hear anything.
Okay. I'm sure Dr.
Can you
Goje can tell us
me now?
It's a bit shaky, sir.
Can you hear me?
Try again? Yes, I think I can hear you now.
Right, thank you very much. So yes, I was saying that there are certain foods which put us at a higher risk of stroke, such as fatty foods, very oily foods, spicy foods, salty foods, and sweet foods. If we overindulge in these in these types of foods, the chances of getting a stroke become much higher. Alcohol, also is a risk factor because when we talk about foods, I think we include our drinks as well. So people who tend not to eat fruits and vegetables are also at a higher risk. Essentially, that's it.
Thank you. I'm taking all this in like my like I went to for a test and doctor is telling me you need to eat fruits, you need to do this, you need to eat vegetables, because I'm guilty. And thank you for explaining on that. We know smoking now, alcohol, if you don't eat veggies, if you don't eat fruits, etc. And I will listen to you, sir. I promise I'm going to eat more vegetables and more fruits. Thank you. Now, there was this question that caused quite a stir in the group, in the chat room yesterday is, what should a bystander do? Now, this one, I'm ready for this. Now, what should a bystander do I'm going to link two questions together, and this is for Dr. Goje and Dr. Balinga. We take Dr. Goje first. What should bystanders do? Now, doing something, I want you to place it in the axis of what should you do if you saw somebody who had a stroke in China, in Nigeria, in Cameroon, in Africa, and in Western countries? I'm sure there are different reactions to that. So what should bystanders do generally first, then country specific, if there is?
Okay. I'm going to start by explaining the facilities in the Western countries and also in China, including Europe. The first response is to call 911 because the time, like I said before, the time management is very important. Calling 911. Then when we take back the same situation to Africa, where calling 911 is not really obvious, So what I'm going to give are just some few tips. You should try to make the person at ease as much as possible. Try to remove any scarf and anything disturbing the person or choking the person, to try to allow air to pass through. Leave the person in a very open area. And there's no really any specific position I know, like in the case of asthma, but what I know is just to try to keep the person at ease as much as possible before calling medical help or carrying the person straight to a medical facility so that the person can get treated as fast as possible.
Thank you. I think that is absolutely what I would do in each country. Before we listen to Dr. Anthony Balinga, please, we'll be taking questions soon. And please type your questions. You can write question and use apostrophe so we can know that it's a question and it's not the very, very active conversation going on in the chat room. Please try to ask questions, write it down, then I'll get back to it soon. Please write your questions down. Dr. Balinga, please, can you tell us more? What should a bystander do, especially in China? Because I'm in China now.
Thank you very much. I happen to be in China as well. Probably most of us are. So here in China, you know, just like in the United States or anywhere else in the UK, the first thing you have to do is call the emergency services. So you have to dial their number. That's the first thing. And the next thing you have to do is notice, take the time. At what time did the symptoms start? You should note that down because you should be able to tell the first responders the symptoms started at about this time, so they can know within which time frame they are working. And make sure if there's nobody else around that you assist this person to lie down on their side, preferably with the head slightly raised up. And this is because a lot of stroke patients, they get a headache and they vomit. So in case they vomit, they should have the head slightly raised up. You should also, if you have some warm coats or other warm clothes, cover them with these on the street. If you have a blanket, it's even better. Avoid giving them any water or any food. And don't move them. If you can, just don't move them at all. And you wait for the, the first aid responders to arrive and you provide them with the information which you have. Essentially, that's what you were supposed to do. But you should also check for whether they are breathing or not. If they're not, you should administer CPR if you know how to do it. So essentially, that's it. So
there is a personal question from me. I hope I don't sound like, okay, I'm not a medical person, so I'm allowed to sound very layman. What is the difference between someone having a seizure and someone having a stroke? I know the facial slough thing is there, but how do I differentiate it? Doctor? So yes.
If I understood clearly, your question was about how to tell the difference between someone having an epileptic seizure, for example, and having someone having a stroke.
Yes.
Well, people who do have an epileptic seizure, they move directly from being very normal to having, spasms, and just dropping down to the ground. They will have no slurred speech. There is no slurred speech usually, and there is often either a retraction of the tongue or even a biting of the tongue which will occur. This doesn't happen with a stroke. You will also find that most people who have a stroke, they are partially conscious or even remain fully conscious during the time that it happens, if it's happening during the day. And so you can communicate with them. It's very or nearly impossible to communicate with people who are having a seizure. So these are the essential signs. But people who are having a seizure also usually get their eyeballs rolled up. This also doesn't happen with a stroke. You just get either the eyes wide open or totally closed.
Thank you much, sir. I end this first section and go to Gujay. Why is there a need to act fast? Why do we need to act fast? Once again, I know you said it, but please can you drum it into our ears again? Why do we need to act fast?
Because the medical intervention fast limits the worsening of the stroke in the future. Like maybe after stroke complications are usually because of the time of action. If you act fast, you have more chance to limit the after strokes, how can I call it, the after strokes effects. So we have to act in the first 3 hours or the first 4 hours.
Thank you very much.
The first hours are very important.
You were still speaking. Thank you very much. Okay. Thank you. So we're going to go to questions now. Please, when we come back from the question section, I'm really interested in pediatric stroke because I read it somewhere and I was quite surprised. Children can have it, teenagers can have it. So it's not just I know being old is one of it, but I read it somewhere and I really want clarifications. So let's take questions now. We're going to take these questions one by one and see what I can go through in some minutes before we go for the second round of questions. Okay. Mr. Nathaniel, please, is there a way you can share the screen so we can see some? Or maybe I just read directly then. The first question I'm seeing here is somebody asking, if stroke affects the brain, does this mean that anyone that suffers a stroke must also have a problem with reasoning or thinking straight? Dr. Gujay.
Not necessarily. Like I said before, everybody that has a stroke, what will give the outcome after, what will happen after the person gets the stroke, after the stroke has finished or the person is okay, is going to be the time of action. Sometimes people get well, other people, they don't. Other people, sometimes they have depression or, like you said, some mental issues. All this depends on the time of action. For example, if I have someone that has a stroke at 12 p.m. and then he had help before 2 p.m. and then another person had stroke at 12 p.m. and he got help at 4 p.m. The prognoses are different. The prognosis for the person that got help at 2 p.m. is better than the person that got help at 4 p.m. So after the stroke, what's gonna happen depends on this time. How early is the person treated? How early does the person get help?
Okay, thank you very much, sir. Quickly, there is a question in the chat room that is particularly almost related to my tribe. I'm a Yoruba and we eat a lot of spicy food. Now, somebody asks, could Dr. Balinga shed more light on how consumption of spicy food could cause a stroke?
Thank you very much. I know this is a big question in people's minds, and I will approach this from a layman's perspective so you can understand. And I am particularly aware of this because I studied Chinese medicine, where we use acupuncture to deal with strokes and stuff like that. Now, I want to ask you a question. If I take pepper and rub on your face, what's the feeling? It burns, it stings. If I rub it in your eyes, you cry. Now, if I put it in your mouth, it stings as well, and your nose runs. Now, why does your nose run? That's because the mucous membrane throughout the entire body will try to protect themselves from what they consider to be an attack. Because pepper is spicy, the cells have a feeling they're being attacked. I'm trying to be very laymanish about it. So they will seek to protect themselves. And how do they do this? They will secrete more mucus than usual. When you consider the fact that we have mucous membrane virtually all over the body, what you're getting is an increase in mucus in the bloodstream, within the blood vessels, in the muscle tissues, and everywhere else. So you're going to get a deposit within the blood vessels as a result of that, gradually over time. And if it's excessive, you're going to be narrowing the blood vessels as a result. Now, in moderate quantities, spicy food tends to dilate blood vessels. So in moderate quantities, spicy food is very good, excellent for your circulation. Now, the problem is when we abuse of it, then the body is struggling to defend itself and produces all this mass of mucus. In Chinese medicine, it said, the more mucus we have in our bloodstream, the more difficult it is to think even in ordinary time. You eat a lot of spicy food. After that, your memory and your thinking functions will slow down somewhat. So this is basically what will happen. And not to go too far, I just want to take
Thank you very much, sir.
Digress a little bit.
Okay.
Okay. Fine.
That is heart-shattering because I'm almost heartbroken because I've been told that I should eat pepper to survive this life, and now you're telling me, you're explaining, and you're telling me so many things, and I'm like, okay, I'm gonna listen to the doctor. So thank you very much, sir, for breaking down the issue on spicy food. Dr. Gujay, please, there is another question on food. Somebody asked if, this is for Dr. Gujay and Dr. Badinga. Somebody asked about if you could go deeper looking at traditional and modern food. I mean, the person said, GMO foods versus organic food. What are some good attitude or behavior to keep up while in China or abroad? Because for me, I find Chinese food very oily. So should we go more organic? Should we eat traditional made food? What should we do? Let's
Dr.
take
Badinga go first.
Thank you.
Yeah.
All right. Thank you, Dr. Gujay. So what I can say is that, there is no way to be absolutely healthy in terms of the air we breathe, in terms of the food we consume, and in terms of the water we drink. Everything's polluted nowadays. So in cognizance of that, we have to now think about how we can make the best of the situation. So there's no need to panic about the whole thing. Now, Chinese food is oily. This is where the knowledge, the understanding of Chinese medicine becomes useful, because Chinese medicine is based on something known as the 5 elements. One of those elements is the wood element. Basically, it represents sour taste. Sour taste, purple colored foods, green colored foods. So these sour tastes, they are very useful for dissolving the fat in your system. Lemon juice, kiwi, vinegar, like you hear people talk a lot about apple cider vinegar, blah, blah, blah. It does work in many cases. It's not a cure-all, of course, but it is very useful. And there are other vinegars which are extremely useful as well, as long as they're not abused too. Lemon juice is one very, very important one and easily available. Even oranges, but more lemon juice, kiwi, cabbages, raw cabbage juice. These kinds of things can help you to reduce the fat inside your blood vessels and inside your body. So every once in a while, you can use them. Dr. Boje is in Shanxi province. I used to be there. I actually trained there and worked in the hospital there. He will know that in Shanxi province, almost every meal is accompanied by vinegar. Almost everything is accompanied with vinegar. The reason is because they're trying to clear the fat out of their system, precisely because there used to be a prevalence of stroke and high blood pressure in Shanxi province in China in the past. The Chinese medicine takes notice of these things and comes up with these solutions. You use wood, you know, to suppress earth. Earth being the sugars, the fats, and stuff like that. So sour foods would be useful, especially fruits, and drinking lots of water, especially hot water. I know it sounds crazy, but it's true.
Thank you very much. Dr. Goje, could you add some things before I say something?
Yeah, I'm gonna add some factors that decreases the risk, like Dr. Balinga said. It's not about what we can eat, but it's about what we have and what we can do of it. Firstly, I would like to say the most important thing in all the situations is to have a balanced and consistent diet. A balanced and consistent diet. That's the most important thing. Adding to that, we have studies going on saying dark chocolate can help to decrease the risk of stroke. I will not go deep into that because I don't really know the whole mechanism. But we also have omega-3 fatty acids. We need to add that more in our diets. We have like whole grains like groundnuts and others. We have white fruits. When I talk about white fruits, I talk about bananas, apples, cauliflowers too, cucumbers, and the rest. This can help us decrease the risk of getting a stroke.
Hi. Can everybody hear me now?
Yeah.
Hello?
Yeah. We can hear you.
Sorry, I was locked up for a second. I'm so sorry. I feel like you have schooled me. I don't know how many years I used to go to school, but I feel like nobody told me that there's actually a detox going on that we don't know about, because I feel like when I eat Chinese food, I'm fatter. My foreign friends complain, oh, Chinese food makes me fat, blah, blah, blah. But I didn't know about vinegar to put it in my food or anything like that. So this is one of the reasons why I'm loving this webinar right now. And to the guests, so we'll take more questions later. We need to go to a very important part of this webinar. Now, I'm going to start with, when we think about stroke in children, I really don't know about it myself. And I have lots of cousins or children around me. I teach in a school. So does it really happen? Does it happen often? How rare is it? And what is the difference between when it happens to a child, a teenager, and an adult? Or is it the same symptoms? We're going to go with Dr. Balinga first. Then we go with Dr. Goje.
Thank you very much. So I'll take it from here, if everyone can hear me. The first thing is we should know, as many people don't know, that strokes can occur in anyone, anytime, including in unborn babies. I know this will shock some people. Strokes do occur in fetuses that are still in their mother's womb. Yes, it does occur. If the mother suffers from an infection or malnutrition or some other specific problem, yes, there can be a stroke in the unborn baby. And then we have stroke in newborns as well. In newborns, what you might see are signs like seizures, you see a baby having a seizure. Then we have to find out exactly what the cause of the seizure is. You might see signs like trouble eating. The baby cannot eat. It's trying to swallow and it's having difficulty doing that, or having trouble breathing, or even pausing sometimes when it's breathing. It breathes and then stops for some periods and then starts to breathe again. These kinds of signs should alert you to immediately call upon the doctor to find out what's going on. You may notice in some babies also paralysis on one side of the body. I was shocked as a young medical student to see this in a hospital in China. I just didn't know this kind of thing happened to babies at the time, you know. So you find a baby who can only use one arm and cannot use the other, for example. Or you may find some developmental delays, like, you know, the baby cannot crawl. When others are crawling, it cannot crawl. These might be signs that there is a stroke going on, or there has been a stroke, you know, before or just after birth. And this is for the, you know, the newborn. But in case it goes to teenagers, you might have symptoms showing immediately or showing even years later, such as these seizures we talked about. They might be there, or they might come some years later. You might find that a student, a teenager, is less awake than others. You're talking to them and they seem dazed, or they lose consciousness suddenly, you know. And you may find also that they have headaches, you know, acute headaches with or without vomiting, or a sudden weakness in one arm, or a sudden weakness in a leg. Or you find that they have trouble walking. When they're walking, they have a gait, you know, like one side is, you know, looking a little bit strange, a little bit odd. You might also have other strange symptoms like switches in moods, sudden changes in their moods, you know, becoming suddenly depressed or becoming suddenly angry, or having trouble, you know, speaking. Or you might find the student unable to read on stuff on the blackboard or even a computer in front of them. They might be struggling, and you see them moving forward. They suffer from blurred vision or double vision. One thing, if you have a child at home, they're having trouble completing their schoolwork, don't quickly start beating them. It might be the, you know, the after effect of a stroke which happened at a certain point before, and they might need some re-education or medical attention. So these are some of the issues we might see. A lot of difficulties with studies, with thinking, with responses. You ask the child a question and it's difficult. You can see they're struggling to find the answer. It could be the sign of a stroke. Thank you.
Okay.
Thank you, Doctor. Thank you, Doctor, because I deal with students every day. And Dr. Gujay, can you please tell us what is the prospect of this child having a normal life after, if a child has a stroke?
As I will say, and I'll keep saying, like there's a very important necessity to act fast, because just like in adults, there are high necessity to act fast to limit the damages. In children, is also the same. There are complications that may occur if it is not treated on time, like hemiparesis, like hemiplegia, like unilateral neglect, aphasia, dysphagia, vision problems, loss of emotional control, mood changes, cognitive changes, behavioral and personality changes. Those are the things that may happen if we don't act fast. So it's going to be very difficult if a child experiences stroke, because in the long run, he'll have to go through re-education, counseling, so that he can get back to track or get back into the society normally. That's what I'll have to add. And to talk about what Dr. Bellinger said, I would like to add something. It's actually a myth. Like stroke only happens to old people, but stroke can also happen to children, newborn, and then even unborn babies. The risk is greater. It's the greatest in the first year of life, right before birth to after birth. And pediatric stroke is actually top 10 in the cause of death in children, if I can recall. So I'll keep saying it, we have to act fast. And like Dr. Bellinger said, in newborns and infants, the symptoms are seizures, extreme sleepiness, tendency to use one side of the body. And then in children and teens, you have vomiting, sleepiness, dizziness, and loss of balance. And since we know children can't actually express themselves like adults, so it's going to be very hard to get the symptoms as fast as possible. So I would like everyone to be attentive when you're at home, because stroke can happen to anyone and at any time. So you always have to check your child, check your cousin, check your brother, to find out. If you find out any of what I have listed is going on, then there's a need to check with your local physician so that you can get help as soon as possible before things go worse. Thank you.
Thank you very much, doctors. I am amazed, and I know that people in the groups on WeChat are really talking about it, and some of them are also amazed that this can happen. So before we go on, we'd like to take direct questions from the guests, from the audience, from our people, everybody here. So if you want to ask questions, you want to ask the doctors questions, please do the usual, the Zoom, and raise your hands where I can see them, then you'll be called. Please use the raise hand function. If you click on settings or more, you find it there. If you'd like to ask questions,
I'm on my full,
please raise your hands.
I'm on my full screen and I can't see the raising hand button, but I have a question.
Okay. Okay, sir. Can you please introduce yourself, please?
Okay, so my name is Hardwell, and I'm also here in China, in the province. So, you know, for me, when the word stroke, whenever I hear this word, okay, the first thing that comes to my mind is that the pathway of blood is blocked, and so it can no longer function, and then there's a problem. So, I mean, I've learned so much already. Like, it can even happen to unborn babies, to either young, even old people. But for me, I think I'm more interested in the diet, in the way we eat, because as I have some background of nutrition, we believe that we are what we eat, which means if we really know what we eat, then you know we can prevent than medicine. Which is my next question: like, what kind of medicine would you recommend? So as I'm saying, you can think about these doctors, like what kind of medicine for the young babies and older people like us. So I think for me, diet is the most important thing. Specifically, you know, I mean, I'm not saying other tribes people are better or not. I think health food can be found anywhere. But the most interesting thing is, you know, to talk about the foods that are high in cholesterol, not just the GMO foods like I asked in the group. So I think I also want to ask this, like, talk about the relationship between stroke and you know, foods which are high in cholesterol. Like, is it true that, you know, foods which are reaching a high level of cholesterol can cause stroke, and how does that work, and how can we avoid it? Yeah, thank you.
Thank you. Thank you. Sorry, doctors, please, can we take like 2 questions from 2 guests or audience before we answer, so we can cover it quickly? I'm going to ask Galaxy Note Edge. I'm sorry, that's the name I can see. Please unmute yourself and ask your question.
Okay, thank you very much. Thank you. You guys are really doing a nice job and being educated. My name is Modestus Joy, not Galaxy Note Edge. Okay, my question is stroke hereditary? Can we inherit stroke from our parents? And now, like the first caller said, what he said, is there any medication, are there any supplement we can take in order not to become victims of stroke? Thank you so very much.
Thank you, Joy. Thank you very much. I'm sorry, that was what I saw on your phone. That was I said that. For the doctors, so there are questions on diet, nutrition, medicine, supplements, and if stroke is hereditary. So let's start with. I'd like to start with Dr. Gojay first. Please, can you tell us about medicine and hereditary stroke? Like that. Can you tell us about that, please?
Okay, I would like to say the best way to prevent stroke is like life changes. You can't take any medicine that is going to help you to prevent stroke. Firstly, you have to check your lifestyle, like Dr. Balinga said before. That's the most important, because once stroke happens, here they're asking, maybe the question is before stroke, but the medication comes after the stroke happened, after the stroke happened, and the treatment is based on which kind of stroke, ischemic or transient attack. The medication can be both surgery or just normal medication. And for hemorrhagic stroke, it can be treated with only surgery. So what we have to do is just to take some clot, the dissolvers, like to dissolve the clot, the blood clot, and reopen the arteries. And an example of such a medication is plasminogen activator, TPA, and it's approved by FDA, and it's also approved in China. And then you can also take anticoagulants, and the anticoagulant has an effect of retarding and inhibiting the coagulation of blood. This is going to help in the easy flow of blood to the brain. You can also take aspirin. Don't overtake, because aspirin too is very dangerous, and clopidogrel. So these are the medicine you can take in case you have a ischemic or transient ischemic attack. And then you can also have catheters, because sometimes some strokes, like maybe they can be treated surgically, even though that is ischemic. All we have to do is just to insert a plastic catheter and then to suck out the clot, so that the blood will be easy to go through. So that's what I have to say about the treatment. But if we talk about before the stroke, I don't think there's any medication we can take. Just like I said, you take a lot of omega-3 fatty acids, you reduce your level of cholesterol, you eat grains, you have a nice lifestyle, don't drink alcohol, don't smoke. That is going to help you a lot. And then I heard another question about the cholesterol level in the blood, how it affects or how it's related to stroke. It's very important, because it's a risk factor that, you know, when you take cholesterol, you can easily have plaques in your artery, plaque formation. So in the accumulation, after a long time taking cholesterol-rich food, the plaques are going to accumulate and become big enough to form a blockage, and blood will not be able to pass. And once blood is not able to pass, your brain is not going to be supplied with blood. And here comes the stroke.
Oh my God, here comes the stroke. That scares me. So when I see oil, I think about what you say, here comes the stroke. But I feel like moderation is everything anyway. Dr. Balinga, now, let's talk about diet, nutrition, medicine, true traditional Chinese medicine. Are there practices like acupuncture, massage? There is one I know, I really don't know how to pronounce it, Qigong or something. I think it's on Qigong, should be like exercise or something. I really don't know how to pronounce it. Or dietary therapy. What should we do? What other practices should we seek besides Western medicine?
Thank you, Eniola. And I'll go on from here. I'm going to try to give a few tips, especially to our people in Africa, where we do not have so much money to spend on hospitals sometimes, or we cannot even reach hospitals because of the conditions of our roads and other things. Now, the first thing you have to know is it's better to prevent a stroke than to treat it. Chinese medicine prefers prevention rather than treatment, but can also treat. Now, if you look at the tongue has a shape. We do not have an MRI in Chinese medicine. The tongue serves us that purpose. It's immediate. We can see everything going on in your system as soon as you open your mouth. And because your tongue is a full representation of your entire being, of your entire body and mind. So I want people to remember this. The tip of your tongue is your head, is the top of your head. And the root of your tongue, which is going towards the throat, this is your kidneys, your waist, and your legs. Now, you could divide your tongue into 3 parts: upper, middle, and lower. We call these the 3 burners in Chinese medicine. And depending on what you see in these 3 portions of the tongue, you can know what is going on from the chest, from the sternum to the brain, between the sternum and the pubis, and between the pubis and the feet. Now, in many cases of stroke in Chinese medicine, we say the stroke is either caused by a blood deficiency, usually more specifically a liver blood deficiency. But in this case, I just simplify blood deficiency because it's often enough to save a life. How do you know there is blood deficiency? Take a look at the tongue. If there is enough blood, the tongue will be fully red, pinkish red. If the tongue is pale, going towards white or transparent, and I'm not talking about the tongue coating, I'm talking about the tongue body, not the coating on top of the tongue. The tongue itself looks kind of like whitish, like transparent, almost looking like stripes from the belly of a cow, going towards white. It means there is not enough blood in this person's body. Now, this white color can be just towards the upper part of the tongue, the middle part, or the lower part, or all of them. So you can know which parts of the body are short of blood before something terrible happens. It is possible. This is one kind of stroke, blood deficiency. Now, the second kind is blood stasis. In blood stasis, what happens? The tongue is dark colored, like purplish colored, or it may appear to be normal colors, but you have black dots here and there, black dots here and there. And if you raise the tongue upwards to look at the under part of the tongue, you find the 2 veins running down are black in color. They shouldn't be black. They should be a little reddish. When you just raise your tongue up, like it should be reddish. When they're dark, very dark, it is a sign you're just about to get into trouble. And you can see this every day. What we do in Chinese medicine, you do that, I see it, I get a needle, I prick them and bleed them out immediately. The problem is solved. Well, for the time being. So these are 2 things. Another thing is what we call yin deficiency. A yin deficiency is what? Fluid deficiency in the body. The body fluids kind of dry out. In this case, the tongue looks red, not just pink, it looks a little reddish. And there is no tongue coating. It looks like it's been peeled. The surface of the tongue looks as if it's been peeled. If it's really bad, you will find cracks, a lot of cracks all over the surface of the tongue. This is a sign that the essential fluids of the adrenal system have been depleted. And when this is depleted, your blood quality will become poor. Your blood quantity will become poor. Your heart rate will increase. But because this is a syndrome, not a symptom, it includes a lot of diseases from diabetes to hypertension to even cancer. But these are the signs. And so another one is, like I said, blood stasis for the tongue is purple. In which case we need to warm the blood. We need to thin the blood. And there are medications for this. But another thing is here on the thumb side of the hand, coming to the wrist, where we have the line. We have 3 fingers applied here, where we can feel the pulses here under the 3 fingers. All you need to look for is speed. If the pulses are very fast, beating pa, 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 faster than averagely normal, you are moving towards high blood pressure and a possible stroke. So it should be slow enough. On the thumb side, it should be slow enough, but not too slow. If it's very slow, like pa, 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 this is blood stasis. You're going to get a stroke because your blood has thickened. If it's pa, 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 something like this, you're going to get a stroke again, not because your blood thickened, but because you do not have sufficient blood and your blood pressure has gone up. So you're looking for too slow or too fast. Both of them are danger signs. A regular rate per minute is okay. When it goes much faster than the regular rate per minute or slower, much slower than the regular rate per minute, you should watch out. If it's slow, the pulse is what we call a fast pulse. It's large under the fingers. If it's too fast, it will be what we call a taut pulse. It's thin, like a guitar string. It feels like a thin string under your hand. Why is it thin? Because there isn't enough blood to swell it out. Why would it be fast? Too much blood is stuck in the veins and cannot move, cannot flow. So it feels like it's fast under your finger. These two conditions will produce stroke. The thin one produces hypertension. You will find these people tend to lose their tempers all the time, feel irritable. As soon as you deal with this problem using an acupuncture point, for example, on your foot, between the big toe and the next toe, where the web begins, you can stick a needle in there. If you have no needle, press with your thumb deep down between the big toe and the next one in the web or behind the web on the foot itself. It's kind of painful, very painful. At the same time, you press here, this web on the hand, between the thumb and the index finger, here. If you press here, you will feel some pain, probably. You press this one, and then you go down to the foot, and you press in between the big toe and the next one. It's painful too. You do this on both hands, both feet, it will drop the blood pressure almost immediately. Another place which is vital, see 3 fingers. And I place them on this line of my wrist. Just after them, I have a finger, usually around where the watch strap will fit the watch buckle, in between the 2 tendons. I use my thumb here, the rest of my fingers on the back of my wrist, and press deeply. It feels very uncomfortable in the wrist here. You have to press in there very deeply in between the 2 tendons. It can be very painful for some people. The more painful it is, the more risk you are at of hypertension, heart disease, and stroke. So each day you wake up in the morning, you should press this area for 30 seconds, let go, press for 30 seconds, let go. Do this for about 2 minutes every day when you wake up. The pain eventually goes away. Stroke or heart attack, and you press here, it halts it. Just freezes it. We stick a needle in there for better effect. Now, another point, behind your ear, if you put your 2 thumbs on that large round bone, and then you slide downwards and backwards, your 2 thumbs will fall into a depression, a hole behind your head, where your head meets your neck. Push in there, and you will feel some pain for most people. Relax after about 30 seconds in your head. Your blood pressure will reduce. So these are key things. there is even better. I don't know if I have the time to continue or if I have overdone my time.
Thank you, sir. You will still give us more explanation, but we want to take one last question. We will take more explanation later. I need to ask the last question, please. I think everybody is carried away. They're really enjoying it like I did. I was busy checking everywhere I could check. Also, okay, somebody said they're getting cold feet. That's fine. I think I might need an acupuncture or two right now because I'm very scared. Okay, thank you. There's a question, Dr. Guje. Somebody said, somebody asked a question, does coffee have any downside in predisposing someone to stroke?
Before answering the question, I am going to say everything in excess is bad for the body. Everything in excess is bad for the body. I've never read or gone through any case where coffee is related to the predisposition of having stroke. So I don't really know that, but all I'm going to say is we can try to take whatever we take in a very limited quantity, in the quantity our body needs to function properly. I don't know if Dr. Balinga has something to say about that.
Dr. Balinga, over to you, sir.
Thank you, Dr. Guje. Thank you, Nyola. Dr. Guje is right. Coffee is not particularly a cause of hypertension or stroke, but if you have a predisposition to hypertension or other, cardiovascular diseases, coffee would not be advisable for the simple reason that it's a stimulant. It's going to accelerate your heartbeat, and according to Chinese medicine, it will deplete your adrenal system even more. So coffee has its uses. It's even beneficial in certain situations. But if you have a predisposition or are feeling like you suffer from pressure in the head or having palpitations and stuff like that, coffee is not advisable. It could worsen your situation.
Okay, thank you. Over to the audience, please. Audience, we need you to talk to us. We need you to talk about your health. We need you to ask questions, please. If you want to speak, please unmute your mic. Nathaniel Edwards, yes. Mr. Nathaniel, please speak to us.
Thank you, Dr. Anthony. Thank you, Dr. Guje. I just have one question about the stroke thing in infants, like a newborn. You said something about how to know if a baby or an infant would have stroke. Okay, now if you're a parent and you are not observant of these things you said, if you want to do an examination on an infant, how do you do an examination? How do you carry out an examination on an infant, a child? So that's my question.
Dr. Guje, you want to try?
Thank you, Mr. Nathaniel.
Yeah,
yes, Dr.
I'm going to say something real. I'm going to say something real quick before giving over to Dr. Balinga. When we have kids, normally, it's true, some people might not be observant enough, but there are some symptoms like seizures. This is something that will not go through unnoticeable. There's extreme sleepiness. This is something that will not go through unnoticeable. Tendency to use one side of the body. It can't go through unnoticeable. When these things happen, yourself, you can't do an extra examination. So once you take your kid to the hospital, there's what we are going to do, like a CT scan of the brain. maybe now I could not present the PPT to show you how to see the CT scan, how to read it, but that is mostly what the doctor is going to do, like the first examination. If he suspects your kid to have a stroke, I'm giving over to Dr. Balinga.
Thank you very much, Dr. Gujay. And I am going back to traditional medicine, you know, the natural stuff. The first thing is, and you will notice, they usually use one hand, but the other hand will be moving. And if one hand moves and the other one does not move at all, this is a clear sign that there is something serious going on. This is one. Two, if your baby is feeding, breastfeeding, or anything, and you notice one jaw, one side of the mouth is sucking, is moving while sucking, and the other seems to be flaccid, this is a second sign. A third sign is moving your finger in front of your baby's face from left to right and seeing how the eyes move. If they don't move simultaneously or in the same direction, there may be trouble. But when your baby cries, for example, observe the tongue. If the tongue is straight, it may be there is nothing wrong. If the tongue is deviated to the side, either to the left or to the right, there is certainly a stroke which has occurred. And for those who have the time to do so, you can point very briefly into your baby's eyes and observe the pupils for any dilation. If the pupils are dilated, there is a, but for things, it's just about the baby's eating, the baby's playing, or the baby's movement, moving with one side, not moving with the other, eating with one side, not eating with the other, breathing and stopping, you know, suspended breathing. These are very obvious things, like Dr. Bujay said. You are with your baby at least some of the time. You must notice some of these things. But some parents just think, okay, this will pass, and ignore it. But if you see this 2-3 times, I think
Thank you very much. I'm really deep into whatever I'm learning, and I'm like shaking my head and seeing how things are going. We need more hands raised. It's time for you to ask all the questions you want to ask, please. Okay, I think we have, yes. Yes. Yes, you can ask your question, please.
Hello. Doctor, thank you very much.
We can't hear you. Hello?
Hello? Hello, can you hear me now?
Yes.
Doctors, thank you very much for this enlightening information you have provided us today. I still have a few questions and I'm a bit flustered. First question, what are the chances of gaining one's sense of reasoning if someone suffers from stroke? Two, the second question, if I may go on, the second question is, when people say partial stroke, what do they really mean? Sometimes people say they've suffered a stroke and they tend to recover, while other times you see people who have suffered from stroke and it's like doctors are telling them if they are able to use a part of their body again, that will even be considered lucky. Then the last question, I'm sorry, I'm asking too many questions. Then the last question is, when people suffer stroke, most times, why does it always have to be half the body, like from the head from one side of the body actually. So if you could actually shed light on this, it'd be nice, because it seems it's not a physical. It seems the illness or ailment actually happens in the brain. Is it?
Um, hello?
Yes, we can hear you.
Yeah, I would like to tackle one of the questions from Rave Solid. He said some people experience strokes that come and go. They call it partial strokes. Some people experience stroke and they can't even get up anymore. Actually, what the people that experience the short time stroke, what we call it is transient ischemic attack. It usually happens for less than 24 hours. So it mimics the stroke. It mimics the stroke, and this is an indication of a future stroke. So once you have these symptoms that come and go, maybe you call it partial stroke, then I will recommend you to visit a physician as soon as possible, because this is an indication of stroke. Once you visit a physician, then the physician is going to analyze the situation, and maybe he can give you like tips or a treatment to try to stop the future stroke from happening. Dr. Balinga?
Thank you, Dr. Gujay. I'll take it from here. I think the first question was about what are the chances of recovering your functionality, like all the functions you lost. Like you mentioned before, Dr. Gujay, the earlier the treatment starts, the greater the chances are that you recover all your functions. The later the treatment starts, the higher the chances that not all the functions will be recovered. It's not an easy situation. But I'll tell you something. As soon as the person has a stroke, or when you want to start treatment, you should seriously consider acupuncture, especially what is known as scalp acupuncture. This is acupuncture of the skin of the head. Needles are inserted in parts of the skin near brain sections which control different functions of the body. So we can influence the brain functions directly by inserting needles in the scalp near those brain centers. This is called scalp acupuncture. And before we practice scalp acupuncture, we test to know what the chances are of this person recovering. And we will take the big toe. Imagine this is the big toe, and the outside, the outside edge of the big toe, where you have the angle of the top and the side of the nail. You have the flesh. This is on the big toe. We will take an acupuncture needle, a very thin needle, and insert in there, going slightly up towards the toe, so under the skin. If your patient reacts, they show some reaction, the foot moves, or the toe moves, the chances of recovery are 100%. If the patient does not move at all, the chances of recovery are 0. This is one way we can use in acupuncture to know, by using a needle in that part of the foot. Now, why is it that only half of your body, one side of your body gets struck in many cases? It's because we have the left hemisphere of the brain usually controls
I'm going to
what
take
happens
over.
on the right side of the body, side of your body. So if you get an embolism, the right side probably will lose its functionality of the brain, then the left side usually loses its functionality. So it's better if this happens in the left lobe, because then you lose functionality in the right side of your body. Your heart is not there, so there is less risk. If the problem happens in the right lobe of the brain, there is more risk of dying because it's going to directly affect the functionality of your heart, which is on the left side. So I hope I answered the question, but we essentially use acupuncture. There are various therapies for this. After the vital signs having stabilized in the hospital, we usually wait for about 2 to 3 months to start regular acupuncture. But with scalp acupuncture, this can be done within a week, within 2 weeks, and the chances of 100% recovery are extremely high. Oh,
Hello,
this
I
brings
thought
me
the
to
network was
something
supposed to
else.
be given.
If I may add, the Qigong aspects, which are just Chinese energetic exercises, Chinese therapeutic exercises.
The Qi, yeah.
There are specific breathing. So I will go on just to finish. There are specific breathing and movement exercises, which we can focus on at some point to help people to prevent and even to treat a stroke. It's about breathing and about movement. These exercises can produce DMT in the brain, dimethyltryptamine, and there are ways of regulating them for therapeutic purposes. We also can use nanoparticles. I have tried to teach people to share my knowledge of how to produce nanoparticles, various nanoparticles, especially those of zinc and copper. You can produce these nanoparticles at home, and you can use water from these particles to treat stroke and other diseases, including, it's a digression, COVID-19. Thank you.
Thank you. Dr. Gujay, talking about future research and talking about future research in the treatment of, can everybody hear me?
Yeah.
Yes, we can.
Yes.
Yes.
Talking about future research and in treatment of stroke, what is the latest breakthrough or the most usually? Okay. Sorry, can everybody hear me? It's a bit noisy on my end.
Yeah.
Okay.
Yes.
Yeah, we can.
So I'm asking about the most recent research on the treatment of stroke, and both in Western and traditional Chinese medicine. Can Dr. Gujay talk about the Western side? Then Dr. Balinga can tell us more about the breakthroughs of Chinese medicine.
Like I said before, the treatment right now approved by the FDA in the United States and in China by the body regulating medical treatments in China is kind of the same. We can only treat stroke based on the type of stroke. Ischemic or transient attack, we can use medication or surgery, or both. Both are recommended. And for hemorrhagic stroke, it's mostly surgically. Like I said before, what we basically do is to give a medicine like a clot dissolver, because what happens in the blood artery is a formation of a clot that blocks the blood from going through and going to the brain. So I talk about a plasminogen activator, which we call PA. You can use it intravenously in the first few hours, and then the person is going to be fine. If we act fast enough, the person is going to be fine. We can use anticoagulants like aspirin. We can use catheter-mediated intra-arterial thrombosis to attain reperfusion in case of ischemic stroke and transient ischemic attack. Surgically, I don't know so much about the other things, but I know like we can use like aneurysm, clipping, coil embolism to surgically to try to remove or dissolve the clot and let the blood flow to the brain easier. So that's for Western medicine. And I saw a question, someone was asking the medicines we can use for a patient that have stroke. I think we have to make it clear, if someone has stroke, the only person that can give a medication or prescription is a qualified physician. We should not do auto-medication. Auto-medication is not good at all. And I think the same methods we use here are the same methods we use in Africa, are the same methods we use anywhere in the world.
Okay. Dr. Guje, sorry, before we go to Dr. Balinga, please. So will there come a time that patients will be able to recover fully based on research using therapy and medication? Do you think that time will come?
Yeah, the time will come. There are a lot of studies going through like electrical impulses to the brain, like some other medications. But I think it's very hard because this is not magic. Once the brain is deprived of oxygen, most of these are reversible because once brain cells die, it's very difficult to reverse the cycle. So maybe in future, we're gonna have something that is gonna help maybe to treat the consequences of the stroke, but not to stop the stroke.
Okay, Dr. Balinga, please. So in the future, maybe there will be something like that. But right now, do we have non-invasive procedures like therapy in Chinese medicine that can come in as a substitute instead of going for other stuff like clippings and all that?
Yes. Chinese medicine and Western medicine are very different in their approach to treatment. Chinese medicine is a holistic concept. And initially, it wasn't even considered. So talking about that way of life, I'm going to start by saying something very shocking, that traditional can, in many cases, relate a stroke and high blood pressure to one's sexual activity. That means for us men, for example, seminal, ejaculation, excessive seminal ejaculation can lead to a point where you get more rapid deterioration of the spinal tissue and brain tissue. I'm just going to make it very simple. You come to a point where you get a stroke or some other complaint. So one of the first things you have to do as a male, I'll come to the female, is as soon as you have a stroke, is to avoid all seminal emission from that point onward until you recover, if it is possible. Avoid seminal emission, because the moment you do, your situation becomes worse. I think you can notice that in most diseases as well. You're starting a fever, it's not serious. Then you have seminal emission. You will notice an immediate spike in the fever. Most men don't pay attention to this, but it is true, it is real. You can observe this after this. So this is one of the first things you have to do. The second thing is you need to practice relaxation exercises. Chinese medicine has the Qigong, the Tai Chi Chuan, and so on. We practice these slow motion movements combined with breathing to slow down the metabolism, provoke vasodilation, drop blood pressure, improve circulation, and reduce the effect. You can even bring about a total cure in many cases just by using these exercises and auto massage on certain acupuncture points. You just need to learn them for a short period of time. It can be done. In more modern times, we have laser technology. One of those lasers is not too far from me. It's non-invasive, and you just apply the laser light of certain frequency, blue light or red light, depending on what you're trying to do on specific points of the body. No needles, and you get the same effect as when you use the needle. So there is laser therapy now, which is becoming more and more popular. And it's non-invasive, there is no risk of infection. But like I said, if you suffer from a stroke by yourself, it's best to not to auto-medicate. It's best to go to a proper hospital, find a doctor, and get yourself treated there. They will know how to use, how to apply all of these techniques there. But if you can't reach a doctor, if you're in the countryside, for example, you need to understand these breathing exercises, these pressure exercises, and you can solve the problem by yourself at that level in that case. Thank you.
Thank you very much, sir. That was very, very enlightening. I gained a lot. Any more questions? Let me check if the audience had more questions for us. Somebody is raising up his hand. Mr. Hadi Malawi. You have to tell me your name. Please unmute yourself.
Yes, my name is Hardy and I'm from Malawi. That's it. So I'm more interested in what Anthony just mentioned about men. Yeah, I was trying to get close to the microphone to try to get everything, but I think he didn't finish talking about that. So Mr. Anthony, Dr. Anthony, would you please like give us some insights? Like, I know, like, you know, it's not easy to talk about this because men usually are shy whenever they're talking about this. So can you just like give more little detail? And if it happens, you know, like, how can a woman respond? I mean, how can your woman notice, or how can she respond, or how can you talk to your woman, like, when this happens, you have to do this? Yeah, just conclude this part. Thank you.
Thank you. Thank you very much. If I may, I'll try to answer your question as succinctly as possible. Everybody knows, well, most people know that most men will die before their wives, but we often do not understand why. A major reason, not the only reason, of course, but a major reason is because of this tendency to ejaculate, to have sexual seminal emission. Every time we do this, we shorten our lifespan somewhat by provoking an adrenal insufficiency. In Chinese medicine, this is known as a yin deficiency. You're putting out the liquid material, the fluid material from your spine and from your brain. It is mixed with the sperm and sent out through the prostate gland each time that you do that. And it takes at least 2 weeks to recover this. But when your body recovers this, produces this, your bone marrow needs to work to produce new cells. And your telomeres, the telomeres of the cells become shorter and shorter. So at some point, you kind of, to put it simply, kind of having your spine material melted, just like butter melting in heat. The brain is melting, dissolving. So you have things like cervical stenosis and all of these happening. So you can explain to your wife, to your girlfriend that, listen, this is what happens to us men. Each time that we have an ejaculation, we lose some essential materials from our adrenal system, and it shortens our lifespan and raises our blood pressure gradually. If your wife understands what you're doing, if your girlfriend understands what you're doing, she will help you even more to control yourself. And by saying control yourself, I'm not saying there should be no sexual activity. No, to the contrary, there should be more. But we men have to learn how to control ejaculation, just that. I know this is going to shock some people, or, you know, like, it's a controversial statement I'm making, that you can be, you know, get together with your wife or girlfriend and not ejaculate and feel good, but yeah, you do feel good. And the longer you can do this for, the better you will feel, the stronger, the healthier, the younger you will be. You can be 60, 70 years old and you will look like 30, and you will feel like 25 or 28. So the kinds of problems most people suffer from, diabetes, hypertension, you will get none of these guaranteed, none of them. So you have to explain to your wife, and she will work with you. She will assist you in this. This is a lifestyle, a way of life. Especially us Africans, we need to learn about this, especially us African males. Women have less of this problem because women do not ejaculate every day. And women just have a monthly period during which they lose some of this essence. And during a pregnancy, a woman loses a lot of this essence as well. But as long as she doesn't have too many children, she doesn't lose as much as a man. And this is a major reason why women will live longer than men, because we men don't know how to manage this. So if this fluid is in your body, your blood pressure cannot go up. And if it does go up with the fluid in your body, it's easy to bring it down. I hope I answered the question.
Yes, sir, you did. And it's causing a stir in the group chats. And I hope that we ask more questions and I transfer it to you. Mr. Nathaniel, it seems like you're raising your hands.
Okay, thank you, Dr. Balinga. I think I'm speaking for a larger percentage of the men here now. You just shook a very, the table was stable, but now you just shook something, so we need to talk about it. Okay. So first, there was a time I was listening to this program, and I heard the doctor said ejaculation prevents prostate cancer or reduces the risk of having prostate cancer. Now, the doctor said the more ejaculation you have actually reduces your chances of having prostate cancer in men. Now we've been on that table and we're trying to see how to balance ourselves. Now, tonight you came and said ejaculation actually reduces our lifespan. So what is going on?
All right, if I may answer the question. The first doctor you listened to was right. He wasn't wrong. When he made the statement that ejaculation can reduce your chances of contracting prostate cancer. And I'll explain why. You know, when we produce a sperm, it accumulates in the area of the prostate, and the prostate gland will swell gradually as we get more and more of this material in there. It will swell and stretch beyond its capacity if this material is not ejaculated, therefore damaging the elasticity and the structure of the prostate gland. If this is repeated for too long without ejaculation, there might be the risk of a tumor or enlargement of the prostate, first of all, and possibly a tumor in time to come. So how can it be possible that I can say, knowing this, that ejaculation would be a problem and that you should reduce it? Well, it's because when you have this material in the prostate gland, you can produce contractions of the prostate gland towards the inside of the body rather than towards the outside of the body. And this material can be squeezed slightly backwards into the body. Instead of being lost, it's squeezed back, then the body disintegrates it and uses this material to rebuild, to support your brain function and your spinal function and your nervous system and your bone marrow, instead of being thrown outside of your body where it's locked to you, and then your body starts using material to build some more of it. So contracting the muscle of the perineal region that is between the anus and the scrotum, that region, contracting those muscles gently, lifting them up, and then contracting the muscles inside the stomach, lifting them up, and the muscles above the navel, contracting them like you want to bring your navel to touch your spine. So you start from in between the anus and the scrotum, and you contract this muscle gently, and then tighter, 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 tighter. You can do it right now as you're sitting there. Just keep tightening, 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 and then go under the navel, inside the stomach, tighten also. So you're tightening both under and below the navel. Then go above the navel and tighten also. You will feel pain maybe because you haven't been using these muscles. Release, relax now. You will feel a rush of energy around the head or the spine. Now, this is key to your survival. This is key to your health. It is key to your youth. It's even key to your manhood. But it's key to your blood pressure. I can't give you all the details in one session, but in 2 or 3 sessions, I can tell you how to work it to deal with almost every kind of disease, just by sitting there and dealing with these muscles and your breathing. There are special ways to do it. But this is the key, contracting in the way I've explained to you. When you do that, the prostate gland is squeezed tight, and the material which is contained is squeezed out of it. And your body recuperates it, disintegrates it, and reuses the material to assist your body in other ways. So I hope I have answered the question. But with regards to sexual activity and satisfaction, because I know that's a question on many men's minds, how can I make love and to my wife and not ejaculate and feel okay? Well, if you take your time, you realize you feel satisfied, you feel peaceful, and you can start again 5, 6, 7, 8 times a day if you want, because you didn't lose anything from your body physically. So it gives you the capacity which men look for by going to buy Viagra without having to buy the Viagra. And it maintains your sexual functions into your 80s, 90s, 100s. You're still the same as when you were about 20 years old. Actually, you're better.
Thank you very much, doctor. Thank you very much. I would love to ask you female related question, but I don't want the men to see you break our table. So maybe I consult you privately to hear that. Now, on behalf of the audience, I really want to thank our doctors. Dr. Guje, we thank you very much. And Dr. Anthony Balinga, we thank you for a fabulous night. I think the group, I'm looking at the group now, and I think I are going on. So thank you very much.